Namaskar, hello, welcome to my channel. My name is Pritha. I am your friendly neighborhood doctor, and today I will speak on health matters for LGBTQ individuals, especially from the point of view of a gynecologist. I understand that sexual and gender minority community often face barriers in accessing healthcare because of discrimination, confidentiality concerns, and fear of being judged or even lack of information. I am a gynecologist, which means I deal with the uterus or the womb, the ovaries or the parts that produce eggs, the fallopian tubes which carry eggs to the womb, the cervix or the neck of the womb, the vagina or the tube open on both sides through which blood passes during periods and penetrative intercourse often happens, and also the external bits down there called vulva. If you have any of these organs, no matter what gender and sexual orientation you have, this video is specially for you. If you get periods, you will require menstrual hygiene products. Unfortunately, they are also one of the biggest environmental pollutants. And if you, like me, wish to adopt an earth-friendly approach, please watch my video on sustainable menstrual products. The link is up here. First, let's speak about menstrual health. People who have periods can have gynecological conditions like fibroids, endometriosis, adenomyosis, polycystic ovaries. So please consult your doctor if you suffer from heavy periods, irregular bleeding, bleeding after vaginal sex, prolonged cycles or even shortened cycles, painful periods, pain in lower tummy arising few days before your periods or lasting after periods are over, pain happening at any other time, pain when you open your bowels or have a wee, pain during sex, difficulty in losing weight, acne outbreaks or new onset excessive hair growth on your face or body. Those who have any kind of gynecological organs can also potentially have cancers in them, so be aware of features like unexplained weight loss, lethargy, abnormal bleeding from the vagina, bloating, lesions or growths in the skin down there. It is particularly important to remember that anyone who has a cervix, which is the neck of the womb, needs to have regular smear tests for a large chunk of their adult life. This is a screening test for cervical cancer, which is easy to do and seriously it saves thousands of lives. It does not matter what your gender and sexual orientation are. If you have a cervix, consult a gynecologist or your local GP to see how you can arrange a smear test. In the UK, NHS will offer you appointments once you turn 25, but in other countries, you might need to organize it yourself. I have long been planning a video on smear tests, and I will put the link up at the top when I finally stop being lazy and get it done. I will also take this opportunity here today to mention self-examination of the breasts, if applicable, as it is an easy and convenient way to pick up early signs of breast cancer. Next, let's discuss sexual health. Now, no matter what organ you have and how you prefer to have sex, any sexual contact, even if restricted to only skin to skin, puts you at risk of contracting sexually transmitted infections. Even if you're someone who was not born with a vagina and had it created surgically, you can still get infections from sex. So always be safe, guys, everyone with no exception. Use barrier methods where applicable. This includes the external condoms used on penis, internal condoms to be used for vagina or anus, or dental dam that is meant to be used when oral contact occurs with any of the bits down below. If you decide to use fingers, you will also require disposable gloves. Keep up to date with vaccinations. Especially important here are jabs for hepatitis A, hepatitis B, and HPV. HPV vaccinations in fact are offered to everyone aged 12 to 25 in both UK and USA. Older adults can also get it after assessing their individual risk. This helps to protect against many types of cancers like cervix, mouth, throat, anus and genital areas. So please contact your doctor to check if you are eligible if you haven't had it already. The other sexually transmitted infection we have all heard about is HIV. The risk is higher with some forms of sexual contact like anal sex, and obviously individual risk will vary. Some people will benefit from taking daily preventive medication called pre-exposure prophylaxis or PrEP, and they are given for people who are sexual with an HIV positive person, people who don't consistently use barrier methods, anyone who uses or has a partner who uses intravenous substances and shares needles, syringes or other equipment to inject. If someone is not on PrEP and had unprotected intercourse with someone who is HIV positive, within the past 72 hours, they need to take post-exposure prophylaxis or PEP. Of course, not everyone will need PrEP or PEP, and if you think you might benefit from them, please speak to your doctor. The signs of commonly occurring sexually transmitted infections in individuals with gynecological organs are usually abnormal discharge from the vagina, which could be foul smelling, lesions or ulcers on skin down there, which may or may not be painful, pain in the lower tummy, pain when having sex. And if you get any of these, you know what to do. Visit your local sexual health clinic or your GP or a gynecologist. Next, birth control. Now, pregnancy can happen when a sperm and an egg get the chance to meet, and it really does not depend on your gender or sexual orientation, but only the anatomy matters here. If you have a womb or the uterus and at least one ovary that can produce eggs and at least one tube, you can get pregnant by any person with functioning testicles. If you were assigned female gender at birth and are on testosterone, you can still get pregnant. If you were assigned male gender at birth and are on estrogen, you can still make someone pregnant. So unless you are planning for pregnancy, please use appropriate birth control measures. You will find details of all available options in my video on contraception. The link is somewhere here. In the last few years, I have in fact come across two individuals who both identify themselves as male, and at that time they were undergoing gender reassignment and had unplanned pregnancies. Both of them wished to continue, but unfortunately, they both ended up in miscarriages. The testosterones and other medications they were on as part of gender reassignment may have contributed. We will never know for sure. But this brings me to the final point, fertility. This is an individual choice. And as I mentioned, if you have any organ capable of making you pregnant, or if your organs can impregnate someone else and you do not wish to have a pregnancy, you will require birth control. If you do wish to become pregnant, you can start trying. You might want to see a doctor to see how to maximize your chances. If you are in a relationship where natural pregnancy is not possible, like same-sex couples, you will require IVF or adoption, and in that case, you should consult a fertility specialist. If anyone wishes to go for gender reassignment process before starting the journey, we advise they consider their fertility aspirations and complete their family before, or if necessary, opt to freeze their eggs or sperms to keep future options open. Additional counseling sessions should be offered if needed. Now, I understand some of you might have had bitter experiences with healthcare providers. I'm truly sorry, but please do not let this put you off accessing healthcare. We want everyone to be healthy, and I promise we are also learning and we are getting better at this. Next time you visit a doctor for any matter of the private beds, inform them at the outset your name, pronoun, gender identity, and sexual orientation. There are lots of LGBTQ ally doctors out there. Just to let you know, a gynecological assessment usually involves an internal examination, and if you think that could be a problem, let your doctor know beforehand. Feel free to have a friend accompany you. I know things are now a bit different with COVID restrictions, but I'm sure we can make exceptions. Lastly, you have many other organs in your body apart from the pelvic bed, so please take care of your complete health. Do not hesitate to seek medical advice, please. If you have any further questions, please comment on this video. My Instagram handle is also provided. You are free to ask questions. I promise to always respect your confidentiality. Thank you so much. Take care. Bye.